Boosters are on hold for most Americans after a surprising decision from the FDA. A panel rejected third shots for the general public and instead backed boosters for people 65 and older. Epidemiologist Dr. Jonathan Kantor with the Penn Center for Epidemiology is here to discuss the decision this morning. Good morning to you.
Good morning.
So I want to ask you this. Why do you think the FDA decided against these boosters right now?
Yeah, I think the critical thing to think about here in approaching what did and what did not the FDA do last week is that this was not the final decision by the Food and Drug Administration. This was an advisory panel meeting, and an advisory panel does not just consist of people who work for the government. What it does is it consists of these independent doctors who work in all sorts of different fields in academia and research, etc. And what they were tasked with doing was deciding, do we have the evidence right now to say, hey, we need to have boosters. It's safe and effective to have boosters for everyone who's had the Pfizer vaccine. And what they said is, listen, the data right now, this preliminary data we have, mostly from Israel, for example, is only a couple months old. It's not enough to show that A, it's 100% needed, and B, that there are no concerns at all about safety given the risk-benefit calculation. And therefore, they said, listen, we're going to approve it for those 65 and older. We're going to approve it for those at high risk of infection, like healthcare workers, for example. We're going to approve it for those who are at high risk of getting very sick. But right now, we're going to hold off on approving it for everybody. That doesn't mean they're not going to. It's just the first step in the process.
Doctor, there's going to be some people that say, look, I've already gotten 2 shots. What's the harm in one more?
Right, and that is actually a reasonable approach, and that a lot of people are saying that. A lot of my patients actually say that to me. They say, listen, I feel much more protected. I felt like I was wearing my suit of armor, and now I feel like there's a chink in the armor. Can't I go and get that armor buffed up again? And I think that's a reasonable concern and a reasonable way of thinking. I don't think anyone has suggested that there is significant added risk, even for young people, getting an additional shot. I think the argument instead is that the vaccines remain very effective at the key endpoint, which is preventing hospitalization, preventing severe disease, preventing death. And therefore, it's difficult to justify, particularly given the global vaccine shortage and other considerations, that we should be giving everyone a third vaccine.
What about people who maybe don't meet that criteria of 65 and older or severely immunocompromised that still want them? Is that a possibility? Can they go to their doctor and ask for something to possibly be considered for that?
Yeah, I think the best way for people who have that concern is most of the people who have that concern probably could justify it within these guidelines by arguing that they are probably, I would imagine, at higher risk. For example, if they're healthcare workers or if they are essential workers, right? We were discussing earlier yard waste pickup. Well, those yard waste guys are essential workers. They are at higher risk of infection. They absolutely would meet the criteria. The other thing to keep in mind, of course, is that this was just a preliminary panel decision. The FDA decision is expected in the next couple of days, and the CDC is going to make the final decision on that later this week, hopefully.
All right, Dr. Jonathan Kantor, thank you for breaking that down. Always good to get your perspective, and I know that we're going to continue to have this conversation as it is a developing story that's going to continue to develop over the next couple of weeks and months.